and archiving it. We are a little bit behind. I have not sent out last week's webinar recording, so I will be doing that very shortly this week. Apologies, but it's been a little bit unexpected and just a lot of activity going on in Chicago. So without further ado, I wanted to just introduce myself. My name is Yasmina Sisteraki, and I'm your host for today's webinar. Thank you for joining us for our COVID-19 webinar series presented by the HealthMatters program in the Department of Disability and Human Development at the College of Applied Health Sciences at the University of Illinois at Chicago through continued partnership with Project Search and their funding from the Ohio Developmental Disabilities Council in collaboration with Aspire Community Services in Illinois. We have added a summer webinar series to provide a space for community providers to share their experiences in maintaining services for people with intellectual and developmental disabilities during the COVID-19 pandemic. These webinars will be recorded and archived. You will be emailed once the webinar has been archived. During the webinar, please note your questions in the chat box or a question and answer box. I will be collecting them, and then I will be asking these questions during the last 15 minutes of the webinars. So for today's presentation, Protecting Ourselves, Protecting Others, Part 1, What to Wear at Work and Why, we are happy to have Melissa Desroches join us again. Melissa is a registered nurse and post-doctoral research fellow at Tufts University. She's a developmental disabilities nursing researcher and educator and a former critical care and preoperative nurse. The mission of her program of research is to improve the health, wellness, and quality of life of adults with developmental disabilities by improving developmental disability nursing care. This presentation will present survey results regarding healthcare needs in community-based organizations, hygiene, personal protective equipment, and social distancing best practices for low to moderate protection and personal protective equipment sequencing will be discussed. Contact exposures and risks for people with intellectual disabilities, along with droplet and airborne precautions, N95 masks, surgical masks, and do-it-yourself face coverings will be reviewed. Again, ask your questions in the text box. Everyone is muted except Melissa, as she's the presenter, and thank you again for joining us. Melissa, I will pass the presentation to you now.
Thank you, Yasmina, and thank you, Beth, HealthMatters, for the opportunity to speak today. The topic, as you know, is hugely timely and important. And ultimately, when we talk all about personal protective equipment and all of the things that we do right now, we're talking about two things. One, protecting ourselves and protecting others. That's the function of PPE. And that's really everything that we're going to cover today, to protect ourselves and at the same time to protect others. So today, as Yasmina mentioned, we're going to talk a little bit about what COVID-19 is, how it spreads, who is at risk. The increased risks for people with developmental disabilities that we need to pay attention to, some survey results about the challenges faced by people with DD in receiving care and having their basic needs met, and what are the current best practices in hygiene, social distancing, and PPE. So today is the basics, back to the basics. About this information, all of this information is publicly available. So there is a handout page that will be provided to you, and it has a long list of resources that come from the Centers for Disease Control and Prevention, the World Health Organization, and other legitimate websites. There is a lot of misinformation out there right now, so it's very important that when you are learning about COVID-19 and steps to take to reduce the spread, that you're learning from trustworthy resources. So all of this information is not my personal opinion. It is publicly available from valid sources. This is for educational purposes only, and so it should not be interpreted as any legal or medical counsel. Please always follow your local public health guidelines or your agency public health guidelines. as always, the information that we present is quickly changing. To the best of our knowledge, this information is all up to date. Okay, so what is COVID-19? So we've heard all about this since the end of last year when this emerged as a new virus found in humans. And the coronavirus is a family. There's a family of coronaviruses, and this particular coronavirus has not been seen in humans before. So for that reason, sometimes we hear this called the novel coronavirus, novel meaning new. And coronaviruses themselves, again, are not new, but it's a family. There are other viruses in the coronavirus family, and some of them cause things like the common cold or other more serious illnesses like SARS and MERS, which you may remember seeing in China several years back. You saw pictures on the news, videos on the news of people wearing masks, and that seemed so strange and foreign, and now it's happening here. So one of the reasons why this is called the coronavirus is because of the little spikes on the virus. So when we look at the virus under very strong microscopes, this is what it looks like. And these little spikes have reminded others of a crown, and corona means crown. So it's very simply named because of its visual appearance of coronavirus. Having a little delay here advancing the slide. Here we go. So how does COVID-19 spread? So primarily, COVID-19 spreads from person to person. So it's typically between people who are in close contact. Now, the exact proximity is not a hard and fast rule. So that's not to say if you are 6 feet away from somebody, which is the number that we see out there most frequently, that you're fully protected. Because this is a new virus and it's not been around as long as some things that have been studied in much more depth, like tuberculosis or other forms of airborne or droplet spread diseases, we're not exactly sure how far is a safe distance. But the research to date shows that somewhere in the realm of about 6 up to 13 feet is about how far this virus typically travels. Now, how does it travel? Primarily through respiratory droplets. So although you can't see your breath when you're breathing out and when you're coughing, sometimes when you're sneezing, you see some saliva particles, but in general, when somebody coughs or sneezes or even talks, there are droplets of water vapor that are coming out of the mouth and coming out of the nose, and the virus travels through the air in those droplets. Some research is showing that the virus can remain in the air for up to 3 hours after a person coughs, sneezes, or talks. But in general, it's this forceful movement that comes from individuals with coughing, sneezing, or talking. And so that's how the virus gets out of people. How does it get in? So when droplets land in the nose or the mouth of a person who's within that range, within that maybe up to 6 feet away or even up to 12 feet away, when they land in the nose or the mouth, or they may be inhaled, that's how the virus gets in. So inside of our nose, inside of our mouth, and inside of our lungs, we have something called mucous membrane. So I think you probably know what that is just by feeling the inside of your mouth, the inside of your nose. It's similar inside your lungs. It's warm, soft, pink. It's a great place for a virus to attach and get itself in. Another way that potentially the virus can be spread, although it's not the primary way, is by touching surfaces that have the virus on it. So we do know that the virus can live for a short period of time on different types of surfaces, and that if you happen to come in contact with the virus by touching a surface, you may then touch the inside of your nose, your mouth, and the virus can then get in that way. So we usually say COVID-19 is spread through person to person as well as potentially surface contact. So what happens when somebody is exposed to COVID-19? Now, it's not 100% that you are then going to get COVID-19. And it's important to note that many people can have COVID-19 and have absolutely no symptoms. This is critically important when we talk about reducing the spread, is recognizing the fact that there are very many of us who could be walking around and either actively have or have had COVID-19 and have no symptoms. We can be carriers. We can spread the germs when we talk, cough, or sneeze, even though we feel perfectly fine and still have no symptoms. There are others who do develop symptoms. And they're very common symptoms that you may see with a variety of other illnesses, including the influenza. But they should be a flag to us to consider the fact that we may need to amp up our precautions and contact a healthcare provider. So primarily, we're talking about fever and cough. It's usually a dry cough. It's not something that usually produces a lot of mucus or a lot of rattling in the chest. It is usually a dry cough. And shortness of breath tends to be a hallmark symptom, or difficulty breathing. So those first three are kind of the classic COVID-19 symptoms. In addition, we also see fatigue. A great deal of fatigue is reported, and not wanting to eat. Mucus or phlegm as well. Although, again, that cough is not usually a junky cough. You may have some mucus or phlegm, and general body aches. There are some other symptoms that are becoming more common as we learn more and more about COVID-19. So one is the fact that many people describe a loss of taste or smell, and I have forgotten the name, but there was a famous basketball player who was one of the first to experience this, and so this was kind of brought into knowledge to this individual. Sore throat is also a potential symptom, headache, chills. There are some gastrointestinal symptoms that sometimes occur, including nausea, vomiting, diarrhea, and a skin rash or lesions, particularly in children. They tend to see a skin rash. So when do these symptoms usually begin? After you've been exposed, about 5 days is the average time frame that you can expect to develop symptoms, although you need to be cautious for up to 14 days. And that's because studies have shown that it can take up to 14 days for when a person is exposed until a person develops symptoms. Again, that average is usually about 5 days. According to the CDC, in general, if you are exposed and you do contract the virus, you mainly are contagious once you begin to experience symptoms. Although because we're not 100% sure, we do have people quarantine if they've been exposed until we're certain that 14-day period has passed and we're kind of out of the woods about worrying or not whether somebody will contract the disease. It's important to note here that most people, in general, develop a mild case. So maybe some fever, cough, a little shortness of breath, some of these other symptoms. There is a self-checker, which is a very useful tool, and it is linked. The link is here in the slide. You can go onto the CDC website and put in your symptoms, and it will let you know if, based on your symptoms, you should seek medical care or if you should get a test. My father ended up contracting COVID-19, and we did go through and use this self-checker, and it was extremely helpful to figure out when you're panicking what your next step should be. So there are some very serious symptoms of COVID-19 that you don't wait to see what your next step is. You want to call a healthcare provider or a hospital right away if you or someone else has one or more of these symptoms. Anytime somebody has trouble breathing, that's an emergency. Breath is life. If you experience constant pain or pressure in your chest, or if you see bluishness to the lips or to the face, that's a sign that a person's not receiving enough oxygen. Or if there's a change in what we call mental status, somebody is suddenly confused, or maybe they are not as conscious, loss of consciousness, or having less consciousness. So you would want to call 911 or a healthcare provider or a hospital right away. Follow your particular organization's protocol in how to reach the emergency services. And it's important that you call ahead. Call ahead and let whoever know that you suspect this may be COVID-19, because there are precautions that are taken by first responders and by hospitals to protect, again, others as well as the individual who's being helped. Again, this list is not all-inclusive, so if you have other symptoms that you are concerned about, please do contact your healthcare provider. So risk factors for COVID-19. This, I feel like, has been pretty well broadcasted, and we've heard a lot about this on the news, particularly as we see groups that are hard hit. So we've heard about the severe illness that's been had in older adults, in people in nursing homes, and people with serious underlying medical conditions. Among those conditions, including high blood pressure, diabetes, asthma or chronic lung disease, heart conditions, severe obesity, and those who are immunocompromised, who've had organ transplants and have to take medications to suppress their immune system or are on immune system suppressing drugs for other reasons like cancer. So these are some of the factors that cause increased risk. Now, in people with developmental disabilities, not only are we considering some of those factors that the rest of us have to worry about with the chronic conditions, including, again, asthma, diabetes, hypertension, we also have some DD-specific risks. So, again, we know people with developmental disabilities often have a greater number of those serious chronic health conditions compared to people without disabilities. So already we have a step up in that department in not a good way. In addition, people with developmental disabilities tend to have greater prevalence of obesity and tend to take multiple medications. Some of these medications can interfere with the body's normal functioning. For example, some anxiety medications can cause more shallow respirations, things like that. So some of the medications can interfere with the COVID progression of disease. Group living situations. We know that people who live in congregate housing or who live with large numbers of individuals are just exposed more to others, and every exposure, every person that you're exposed to increases your risk. People with developmental disabilities, by the nature of the disability, have a dependence on others, and so often require people to be in their personal space, and so they cannot completely social distance as others may be able to. Also having paid staff. Paid staff may be working in more than one residence or agency, and so they can be a carrier, an asymptomatic carrier between different residences. People with developmental disabilities may have difficulty communicating. And what this means is some of those early symptoms that are just kind of the fatigue, maybe when you have slight fever and chills, those very early symptoms that often we can't pinpoint, we just don't feel right. People with developmental disabilities may not be able to express that they're feeling that way. Behavioral challenges. So the difficulty with social distancing and understanding why a person may need to stay in their room if they're suspected to have COVID, or why they can't go out to their favorite outings in the community. And when it comes to hospitalizations, people with developmental disabilities have higher rates of hospital complications and death. So it's very important that we address the increased risks of COVID-19 in people with developmental disabilities. Some specific challenges, not relating to biology, but in general, up until this point, there have been few public health guidelines directed towards people with developmental disabilities who live in the community. Notwithstanding that, the guidelines that we do have in existence, they're not necessarily accessible or easy for a person with a disability to understand or adhere to. In addition, many people with developmental disabilities live with family caregivers. And when a family caregiver is an elderly person or an older parent and they become ill, this poses significant challenges in the family as who is going to assist and provide support to the person with the disability. In addition, we know that people with developmental disabilities and complex health conditions require a collaborative approach, a partnership with family, other caregivers, hospital staff, and making sure that we're able to get everybody on the same page with decision-making, advanced care planning is also challenging. So multiple level challenges. This was the target of a recent research study that I conducted with Sarah Ailey, Kathleen Fisher, and Judy Stike with the Developmental Disability Nurses Association. And we saw so much going on in the world relating to nurses and the care that was being provided. And we thought, nobody's looking at how nurses are actually able to meet the needs of people with developmental disabilities living in community settings right now. So we surveyed nurses. This was from April 6th to April 20th. And we asked them about the challenges they face meeting a multitude of needs, physical health needs, mental health needs, social health needs, and COVID-19 related needs. And I've highlighted some of the key pieces about what we're going to talk about today. We found that the nurses stated that direct support caregivers are the workers. They are the ones doing all the work. And infection control is just not something that DSPs have been trained in. There's a lot of fear out there. There's concern because DSPs are working in multiple residences, and we're concerned about the staff cross-contaminating different residences and bringing in COVID-19. The staff are so fearful because of all of the different misinformation that's out there. Residents are afraid, staff is afraid, and there's just an overwhelming amount of information, and it's hard to tell what is valid and what is true. So what can we do about this? So in the next 20-25 minutes or so, we're going to talk about specific recommendations that have recently come out from the Centers for Disease Control related to direct service providers and group homes for people with disabilities. We're also going to review some very basic infection control practices and the appropriate and proper use of personal protective equipment, otherwise known as PPE. And we will also just spend a couple moments debunking some common myths, since there is so much misinformation out there. So one of the most basic ways, or the 5 most basic ways probably, that we can protect ourselves and others on an individual level are these things here. Washing your hands. So I don't know if you've ever had a tutorial on washing your hands, but the idea is you want to wet your hands. You want to use soap. Soap and water is actually gold standard and is recommended over hand sanitizer because what you're doing with soap and water is you're actually rinsing the germs off, versus with hand sanitizer, you're waiting to kill the germs. You're not actually removing them off. So soap and water is always the best if you can use it, and you want to get into all of the nooks and crannies. So oftentimes we miss areas in between our fingers, underneath our fingernails, the back of the hands. When I worked at the hospital, the infection control department would give us this goo to put on our hands, and they'd have us wash our hands and then look under a black light, and there were always so many areas that we would miss and then be embarrassed about. So imagine that somebody is going to do that to you after you wash your hands. You want to make sure you scrubbed every area. And I'm sure you've heard now to sing the ABCs while you wash, because it takes about 20 seconds. If you Google it now, there are people who are sick of singing ABCs, and they have found a whole bunch of other songs that you can sing to wash your hands. And you always want to wash your hands after you are in public spaces or using a bathroom, before and after you eat, before and after you provide personal care to somebody. If you're touching personal items, tissues, you want to wash your hands after that. And then if you have no soap or water available, using an alcohol-based hand rub that contains at least 60% alcohol is an acceptable alternative. Please don't leave it in your car. However, we've been seeing images of fires being started by leaving alcohol in the car, as well as the fact that the alcohol can break down and it can be not as effective. So principle number 2 of basic hygiene and infection control is don't cover your mouth with your hands when you cough or sneeze, because then you're invariably going to touch something. You want to use the bend of your elbow or a tissue. Again, we know it's spread through droplets, so basically we're putting up a protective wall. We don't want those droplets to launch further into your air. And usually we're not using the bend of our elbows for much, so we're not really worried about cross-contaminating from the bends of our elbows. Again, very important. Avoid touching the eye, the nose, the mouth. These are our mucous membranes. They're soft, warm, and pink. That's what you can remember, what a mucous membrane is. You don't want to rub your eyes, pick your nose, touch your mouth. These are how germs get in. You can still touch your face if you need to use a tissue, something you can throw away or launder. But just please remember, consider when you are have been out in public, if you've been out in the supermarket, you're touching the handle of that carriage, even if you're wearing gloves, you still then should not be touching your face, because what's on your gloves can then get in your eyes, your nose, your mouth, etc. You're not wearing gloves to protect germs from getting in through your hands. You're wearing them so that you're not getting things into your eyes, your nose, and your mouth. And we'll talk about gloves a little bit later. Another basic aspect is to avoid crowded places. We've heard about social distancing because it's mandated for us. So the idea is to put that physical distance between yourself and other people. And I really like this graphic because it shows the impact of social distancing. So if we are, for every person that is positive, is infecting 2.5 people, in 30 days, each of those 2.5 people infect 2.5 people. At the end of 30 days, we end up with 400 plus people infected. If we really minimize our contact with others, we can go from 1 person to only 2.5 people infected. So we're, again, very careful to stay away from other people as much as we can. And finally, seek care if you feel sick. We don't want to be going to work feeling sick. The sooner the better if you're feeling sick. And I want to highlight the fact here, and I did yellow it, it's okay to have a runny nose. We're running into allergy season now, which I think really freaks a lot of people out because you can't tell, is this a cold, am I sick? If you're just having a runny nose and you don't have a fever, you don't have a cough, pain in your chest, or other symptoms, it's probably not COVID. However, if you're feeling uncertain, please do contact your healthcare provider. So household hygiene is another way we can protect ourselves and protect others. The idea is any commonly touched surface, we want to routinely clean. And we need to clean it, then disinfect it. So cleaning is soap and water. Maybe rub down your door handles with a face cloth with your dish soap or your household soap and your water. Let it dry, and then you can go ahead and spray it with your disinfectant. So cleaning removes germs. Again, disinfecting kills them. You want to use a disinfectant that is approved by the Environmental Protection Agency. You also want to be sure to follow the instructions. So certain disinfectants, they need to be wet for a certain period of time in order to kill the germs. So you need to make sure you've sprayed that area heavily enough so that it's wet long enough to kill the germs. Sometimes you also need to wear personal protective equipment when using disinfectants, depending on what the chemical is. And please do be sure that with these higher level disinfectants and cleaners that we are storing them safely so that others cannot get into them and be harmed. And the CDC website has many tips relating to cleaning and disinfecting your homes. Finally, on May 27th, 2020, so just recently, I think it was Thursday or Friday, I've lost track of the dates like most other people now, the CDC released guidelines for direct care staff, for group home settings, for families caring for individuals with disabilities. This was greatly needed because a lot of the other guidelines just didn't fit the population of people that we work with or the settings where people with developmental disabilities lived. So these are the recommendations hot off the press from the CDC. The first for direct care staff is, when possible, to keep 6 feet away from others. Now, I understand there are some individuals that we support that we need to be in their personal space to provide care. But there are others that we can assist and support by using cueing and supervision. So if we can maximize what we can do with cueing and supervision, that's what's recommended. It's recommended to wear a cloth face covering when you are at work. Now, this is assuming that there's nobody COVID positive, and this is just a general precaution. If you are able, please do wear a cloth face covering, and encourage your client to wear a cloth face covering as well. Now, there are individuals who cannot tolerate cloth face coverings, and that's okay. In addition, there's comments popping up in front of the screen. In addition, we will talk about, rather, how to make and take care of your cloth face covering in a moment. If you are at risk of being splashed or sprayed by body fluids, you should use something called standard precautions, and we'll talk about that. This is a healthcare term that we talk about in the hospitals. Anytime we're at risk for coming in contact with body fluids, we gown and glove up, wear masks, wash your hands regularly. It is encouraged now to wear disposable gloves when touching the client. And when you get home, launder your work clothes with the warmest water and dry completely. And this is just to ensure that the virus, if you had it on your clothing, that it is killed off, since we do know that this can live on surfaces for a short period of time. And monitor yourself for symptoms. So check yourself for fever. We usually have people monitor themselves once per shift, but if you're not working that day, certainly at least once per day. And don't go to work if you have any symptoms. That's hugely important. You don't want to carry this in to a residential care setting and potentially infect others if you're experiencing symptoms. Now, group home guidelines have also come out. Some of these guidelines pertain to being sure to communicate to staff and residents in an accessible and understandable format. And this has been challenging. I know in future webinars through HealthMatters, there is going to be a presentation all about resources that are available in accessible and understandable formats. The CDC website does have some as well, and the handout that's provided for you at the end has some posters and printables. But it's important to communicate. And I know that's been a challenge, especially as things have had to shift online and we're not able to do as much face-to-face training. But it's important that we're taking the effort to communicate about what are actual risks and how we can overcome these risks. In addition, the guidelines recommend, as we all know, we should be assisting individuals with disabilities to participate in COVID-19 prevention. So we shouldn't just assume that they're not able to partake. We know that there are ways that we already do health teaching with people with developmental disabilities. We know what works already for other topics. We just need to apply this to COVID-19. So using visual and verbal reminders for hygiene, for cleaning common surfaces, for washing hands, for not rubbing your nose and touching others. So providing those usual accommodations and assistance in the setting of COVID-19 prevention. And we may bring in our behavioral techniques and our positive behavioral supports to help residents adjust to these changes. Our survey results show the huge impact that these behavioral, that these routine changes are having on the mental health and behavioral health of people with developmental disabilities. This is a huge burden right now. And doing whatever is working to reinforce the positive desired behaviors is what's recommended. Whether or not it's the picture schedules, the timers, all of those positive behavioral support strategies, we need to use them to help people cope with these changes in routine. And then we should always, of course, stay stocked on an essential amount of food, medical, or other health-related supplies. In addition, you could expect as a direct care staff that you're going to be screened on a routine basis. And if you're not doing this already, this is something that you should put in place. Everybody should have their temperature checked at least at the start of every shift, and you can expect to be asked about whether or not you're experiencing coughing, chills, fever, shortness of breath. If at any point during the shift the staff develops symptoms at work, they need to put on a mask, tell their supervisor, and leave immediately. There's no waiting to see how you feel. Maybe I don't feel that bad. No, you need to just cold turkey. You need to be gone. It's important also to plan for essential outings. People with developmental disabilities may be employed in the grocery stores or other essential jobs. So it's important that we assist others with using these appropriate protective measures, whether or not they're using public transportation, they're working at the supermarket, whatever it is. We need to be sure that people have the resources that they need to be able to go out safely. In addition, hospitals and other healthcare settings have been reporting that they have not seen their usual volume of patients for many chronic health conditions, which means that people are not going out to get their routine medical care. And this can cause huge problems for people with missing care, can lead to higher rates of problems, including death. So it's very important that we still seek routine medical care for underlying conditions. I am very pleased to see in the guidelines that the CDC has specifically stated that a staff, a direct service provider, or a family member should be allowed to accompany a person with a disability as an essential accommodation. That's huge that that's recommended. In addition, guidelines for group homes state that you should consider limiting the number of non-essential visitors to reduce the potential spread of asymptomatic COVID, as well as to prepare for staff shortages, just anticipating that some staff may become ill. And you can find all the guidelines on the CDC website, which is also listed in the handouts. So the CDC guidelines for direct care staff did mention standard precautions, so I'd like to explain what those are. All that means is that any time that you are doing something where you have the risk of being sprayed with or splashed with body fluids being saliva, urine, feces, blood, semen, trying to think, really anything liquid that your body produces, snot, mucus, anytime you may be sprayed or splashed, you should be wearing this protective equipment, assuming it's available where you are. We know there are PPE shortages, although this does seem to be getting better. And the things that you would wear would be a gown to protect your clothing, eye protection because we don't want these wet substances getting in the mucous membranes of the eyes, a face mask that also covers the nose, and then gloves. So that's what standard precautions refers to. Now, there are many types of personal protective equipment. We've all seen gloves and face masks, which cover the nose and mouth. Face shields are those plastic sheets that cover the entire face. Gowns, which we have disposable and reusable, goggles, and N95 respirators, which are those heavy-duty gold standard masks. Now, PPE recommendations change. They change according to what's available. The CDC releases guidance on this. You should refer always to the CDC and OSHA above anything else for recommendations. How we decide what PPE to use is usually based on the hazard to the worker. So meaning how dangerous it would be and how the agent is transmitted. So again, standard precautions is kind of when we just assume that any body fluid may be potentially infected. When we know that a person has a particular infection like COVID-19, we then switch to this more transmission-based mindset. Transmission-based means we're thinking about how this particular agent is spread. And so for COVID-19, we know this is a mix of kind of all of these three. Contact, we know we can get it by touching surfaces to a certain extent, and then a mix of this droplet and airborne. So droplet, again, is when you have those water particles, when you cough, talk, or sneeze, and they're going in the air, and they're usually not going more than about 6 feet from the person. But then there's this element of airborne that we're hearing about, where these virus particles can stay in the air for about up to 3 hours or so. So the recommendations that we have are based on the particular way that COVID-19 is transmitted. So PPE, we need to wear it consistently, so not just sometimes or when we remember it, and we need to wear it properly. Wearing a mask below your nose doesn't really help that much, or pulling it down to talk doesn't help. We need to make sure our personal protective equipment is inspected and maintained. Make sure that your mask doesn't have a big hole in it, or that there's gaping areas out the side, and we need to replace it when it's not working. We also need to be sure, and this is extremely important, that the way that we're taking off the PPE is not contaminating ourselves, others, or the environment. And we will talk about how to remove PPE as well. So gloves. Gloves we need to wear in two scenarios. One is when we're using disinfectants. Many disinfectants are very harmful. They can cause skin peeling. If your EPA label, your EPA disinfectant is telling you to wear PPE, please do. This can be reusable gloves or disposable gloves for cleaning. And it's to protect your hands from the chemicals. We also now have the recommendation to wear gloves when touching the clients, handling tissues or changing linens or doing laundry, anything where that virus may linger. And we want to then just use disposable gloves and be sure that we dispose of them, remove them properly, and dispose them in a lined trash can that can be kind of taken all out of the trash and thrown away without us having to touch it again. We always wash our hands before and after using gloves. So donning and doffing gloves, or putting on and taking off gloves, you again always wash your hands first. And you still want to cover, you still want to wear bandages if you have any open areas, because germs can enter through open areas. Gloves aren't 100%. And then you put your gloves on. So putting gloves on, pretty self-explanatory. We don't have to worry about being sterile when we're putting on our gloves, because these gloves are just to protect ourselves. We're not worried about creating problems with bringing in germs into a sterile field. So we can pretty much just put the gloves on. And then do our thing. Make sure you can think of it when you're wearing gloves, pretend that you dipped your hands in paint. And once you have those gloves on, you don't want to touch anything that is going to be considered clean after that. So you wouldn't want to touch your face. You're not going to want to touch your cell phone. You're not going to want to touch your car keys. You're not going to want to touch anything while you're wearing those gloves, except what you need to do. Consider yourself contaminated, and then you want to take the gloves off. Now, when you take gloves off, you're remembering that dirty touches dirty and clean touches clean. So you can pinch the inside of your glove to kind of pucker it up with your dirty hand and touch the dirty part of the glove, and then kind of pull it up and take that one off. And now you have one glove in your hand, and it's your dirty gloved hand, and you can, with your clean hand, reach under the cuff of that other glove and pull it all up. And now you have kind of a ball, kind of like when you ball your socks. Now you have gloves in a ball. And you can see this technique. There's a visual here. There is a link in the resources page, but you always want to wash your hands after removing gloves, and please don't reuse disposable gloves. They're not meant for multiple uses. They may break. Now you can see in the CDC guidelines that do-it-yourself face masks are recommended. You want to use do-it-yourself cloth face masks for low-level protection when it's not suspected that you or somebody that you're working with has COVID. Wearing do-it-yourself or cloth face masks it's considered a kindness. You're wearing that mask to protect the other person from your droplets getting out into the air, and the other person is wearing that to prevent their droplets from getting out into the air. The best material is to use 100% cotton. It can be laundered easily, and it's a double layer of cotton. Many different patterns are out there. I believe there is one on the reference list or the resource list, but at all points, the mask needs to cover your nose and your mouth, and it shouldn't have big loose areas. And remember, it doesn't give you 100% protection. It's to protect others from your droplets. There are some common problems if you're wearing face masks all the time. Maybe your ears are sore. You may feel like you're having trouble breathing, but it's common. Healthcare workers wear masks quite frequently, and it's something you just get used to. It feels a little claustrophobic at first. Your glasses can get foggy. They do make glasses defogger. They recommend that you wear your mask a little more tightly over the top of the nose if you're having that challenge. You can have headaches, and the idea there is to make sure to drink enough fluids, to take breaks, to get your fluids in. And there are devices. This man is wearing a paper clip to take the pressure off his ears. You can kind of put a paper clip and have the ear loop into the paper clip. There's many hacks out there. You can Google them. There's so much out there right now. Now, if somebody in our care, we suspect that they have COVID-19 or it's been confirmed, we take this whole idea up a notch. So the cloth masks are not optimal anymore. We are using a surgical mask or ideally an N95 respirator. So we're doing all of the same things that we did for standard precautions, the gloves, the goggles, the mask, the face shield if we have it. And we put this all on before we go into the client's area. We wear it completely the whole time we're working with them without touching anything, not touching our mask, not touching anything of our personal protective equipment. And then when we are leaving the area, we're removing this very consciously, not to contaminate our clean selves underneath or other things in our environment as we're leaving the room. Now, surgical masks and N95 respirators, again, we save for healthcare situations when we need them, like when somebody is suspected or confirmed of having COVID. Otherwise, we're using those cloth masks. The surgical masks we wear, it says warm, should be worn with the white side next to your skin and the colored side on the outside. N95 fit more securely on your face and against your skin, and they block out 95% of very small particles, which is why we call them N95. Per OSHA, for their guidelines, we have fit testing to wear an N95 respirator. You're supposed to be trained and have it a size fit to your face. That's something that perhaps is not happening right now because we're just trying to get N95s into the hands of people that need them. But the idea is we want to be sure that that seal all around the edge of that circle respirator is up against your face and there's no place for any air to get through. Isolation gowns are also in short supply, and so we may see that we're not using gowns for standard precautions right now as much as we usually would because we're saving them for COVID-19. But you have to follow the guidelines that are out there in your agency. There may be more reusable gowns available, and so in which case we launder them, again, in the warmest fabric, the warmest setting that the fabric can take. But usually we are using gowns, again, for suspected or confirmed positives at this time. Now, how we put on and take off PPE is very important. So you always want to make sure when you're getting ready to wear your PPE, you have it all right with you. You're washing your hands first. You want to think about the fact that you want to put on what's going to get the dirtiest last. So you're putting on your gown first. Then you're putting on your mask. Now, when you put on your gown, you don't want to leave it flapping. You want to have it securely tied. You want to wear your mask and make sure that you're adjusting it with both hands to fit your nose so that there's no air seeping around. You then want to put on your goggles or your face shield and end with your gloves. And if you hold your hands above your head, you can remember that you're putting this on from bottom to top. And that's how you can remember the order of donning PPE. When you're taking it off, you're basically going in reverse order with a little modification. The first thing that you're removing is your gloves. Again, making sure not to contaminate your hands, keeping what's contaminated on the inside of that glove ball. And then you're removing your gown. If you have a disposable gown, you can gently pull and tear it. And really what you do is you're kind of moving it away from your body towards the front of you and you're rolling it into itself. So everything soiled is on the inside. At this point, if you're still in the person's room, you can come out of the room and wash your hands and then take off your face shield or your goggles. And you do this by the side. We don't want to touch the contaminated front part. We want to take off from the side. Then remove the mask or respirator. And again, we don't want to touch that front part that may be contaminated. We want to pull off from the straps, from the back of our head. We don't want to touch it. If it's disposable, we're throwing it away. There are crisis guidelines now where some are reusing respirators, in which case you have to follow your agency guidelines. But you don't want to touch the part that has been exposed to the air on the client side. And then very importantly, perform your hand hygiene. Soap and water, 20 seconds, all the nooks and crannies. Now, there are some best practice recommendations out there in terms of balancing your work and home and how you're doing this, being an at-risk healthcare worker, because DSPs, you are healthcare providers, just not necessarily by that name. But again, you want to monitor your health, check your temperature. We know that although many people can be asymptomatic when you have COVID, some people just have mild symptoms. You want to check your temperature at least once a day. You want to have a separate set of clothes that you're wearing, that you can leave basically everything you don't need at work at home. Pull your hair back. Try not to wear contact lenses. And then you can bring a set of clean clothes to change into after work. Some people change into their clothes in the garage or even at another place, if there's another place in between home and work that they can access. We always, when we are healthcare providers and we're worried about taking something home, you're using your hand sanitizer. When you're getting in the car, you're wiping down the steering wheel with your Purell. Anything you touch, pretend again you have paint on your hands, anything that you've touched since you've been at work, you want to make sure you're cleaning and sanitizing. Before you are leaving work, again, sanitize everything. This is a great idea to put your clothes and shoes in a cloth bag that you can just toss right in the washer at home, one of those mesh bags. When you arrive at home, identify a room that's only used for you. Again, we've talked about using the garage sometimes. And regularly disinfect your home. You don't have to be obsessive, but just remember, disinfect regularly. Now is the time to plan for COVID-19 in the residences of the people that we serve, as well as in our own homes and residences. Despite all of our best efforts, COVID-19 will still be transmitted. We need to plan for the event that either you as a staff person fall ill, and who's going to support you and your family, who's going to cover for you at work. What is the crucial information that needs to be available, both at work and at home? What needs to be known about how your household is run, whether it's the DD setting, whether it's your home life setting. What's the crucial information that somebody that's not familiar with your residence needs to know? Who can assist, and what are the available resources? How are you going to get groceries? How are you going to get medical supplies? We have to make sure we're stocking up on medications and supplies. And importantly, making sure that our own and the clients that we work with, that care plans and health records are updated. We want to make sure people are, if they're needing to go into the hospital, that they're getting the medications that they are taking on a regular basis. So now's the time to go through and update everybody's care plans and records. Now, there are some common myths, and we'll end with some common myths related to COVID-19. So myth, everyone with COVID-19 dies. This is not true. As we mentioned before, COVID-19 is only fatal for a small percentage of people. Around 80% of people experience the most mild form of disease. Other myth, COVID-19 is just like the flu. This is false. Although COVID-19 does have flu-like symptoms, both can lead to pneumonia. In general, COVID-19 is more serious. There does appear to be a higher case fatality rate in the U.S. related to the flu, and that just means out of the number of people that contract it, it's the number of people who die from that. A myth is that children cannot get COVID-19. Children can get COVID-19. They don't tend to get it as severely, but we are now seeing a profile in children similar to Kawasaki disease or toxic shock syndrome. It's an inflammatory condition, so it doesn't show up the same way in children. Another myth, face masks always protect against coronavirus. We know that this is not true. Oftentimes, we are wearing our cloth face masks all the time. We're wearing those to protect others. And even N95s only filter out 95% of particles. Another myth is that home remedies can cure and protect against COVID-19. We know that there have been many, many false claims out there about medications, garlic, elderberry syrup, so many different things. As of right now, there is no proven cure or remedy for COVID-19. And again, some have heard or will hear that antibiotics kill coronavirus. We know this is not true. Coronavirus is a virus, and antibiotics work on bacteria. So just know there is no antibiotic that will help kill coronavirus. Sometimes antibiotics will treat other things that may come up in the course of a serious illness, like a urinary tract infection from using a catheter or something like that, but they don't actually kill the coronavirus. I'd like to end with a thank you to all the frontline workers. What you are doing is extremely important, and we know that people who support individuals with developmental disabilities are not valued in society, despite the fact that you are absolutely 100% healthcare heroes and frontline workers. So thank you. There is a handout with many additional resources. There's far more information than we could fit in this time frame. Just please remember, when you're looking for information, make sure it comes from a valid source like the CDC, the World Health Organization. There is a lot of misinformation out there. So thank you.
Thank you so much, Melissa, for this very informative presentation. I don't want to waste everyone's time. We do have a bunch of questions, so I'm going to just start asking them. What is normal oxygen level measured by a home device?
By a home device? I'm not sure that there's a difference between a home device and a hospital-based device. Usually we like to see in healthy adults 98 to 100%, but it's very individualized based on a person's underlying conditions. So somebody with a chronic lung disease, their highest oxygen level may be about 89% at baseline. So it's individualized. So that's not something that I could say across the board. It should be a certain number.
Thank you. When gloves and other disposable PPE are removed, should they go into biohazard containers or simply the wastebasket?
Waste baskets, unless they are contaminated with blood products, body fluids. But in general, you know, if you've performed personal care and it's not saturated with body fluids, it can go into a regular wastebasket. You just want to be sure if you're supporting somebody with DD. I know that I've had individuals that like to rifle through wastebaskets. So you want to be sure that you're able to put these in a place where nobody's going to then touch that.
Thank you. I'm getting a lot of questions about PowerPoints and materials. We will post them on our website, and we will be letting you know via email when everything is posted. So you will get all the resources available. And we have your email since you've been registered for the webinar. Wearing masks for long periods of time has shown to cause lung damage and other health problems. Shouldn't this be addressed with program directors, employees, et cetera, in order for them to take necessary precautions?
I can say that as a healthcare provider, as a registered nurse, I've worn a mask. We have never heard of any health problems, nor have we faced health problems from wearing these masks over a long period of time. So in the setting of an otherwise healthy person wearing a mask to protect themselves and others, that's not something I personally would consider a health risk. If you have an underlying health condition, respiratory condition, that's certainly something that you should discuss with your doctor. And the CDC guidelines do recommend and do allow for the fact that there are some who do not tolerate a face mask. And so that's a conversation you'd have to have with your doctor as well as with your employer about how you would then participate in your workplace without being able to wear a mask.
Thank you. What if your job duties require you to meet clients in a meeting room that does not meet 6 feet distance and no ventilation? Is it best to continue remote meetings when you're unable to meet clients within areas not allowed 6 feet distances?
I think this all depends on the specifics of the situation. So right now, we are seeing the governor still recommend social distancing. If we have the ability to stay distanced for meetings and hold them remotely, that's really best practice right now. We see this with telehealth. We see that, although in usual time, it is best for us to meet with our clients face-to-face, right now we are weighing the risks of COVID-19 exposure. So if there is a way to minimize risk by social distancing, then I would go for that. If you do need to be within somebody's personal space to provide care or whatnot, and they are not suspected to have COVID-19, then I would wear my cloth mask just as I would if I were going out in the public.
Thank you. This is a very important question, and there's a lot of confusion about masks. So why are cloth masks only protecting others and not yourself?
Cloth masks are not made the same way that an N95 is. An N95 is designed so that air particles, 95% of particles that are in the air will not get through to the other side. Cloth masks, they're just fabric. Fabric wasn't designed from a healthcare perspective, right? It's designed for our curtains, for our bed sheets. We have all different thicknesses. What we're doing is we're trying to keep the droplets from getting into the air. So when I wear a cloth mask, basically I'm just keeping droplets from going further in the air. I'm keeping them closer to my mouth by wearing the mask. So we're really reducing what's getting into the air to begin with, and that's how we're protecting others. When others wear a mask, they're protecting me because what they would be normally coughing or sneezing 6 feet out into the air near me is now not getting out into the air. So the cloth mask is considered a kindness that you do for others because you're keeping your germs within your personal, very personal area behind that mask as much as we possibly can.
Thank you. Do you need to wear a mask under the face shield, or would just the face shield work so that the client can see your face?
I think this is a great question because I would love for clients to be able to see our faces, but no, you do need a mask with a face shield. The reason being that there is still air that can get around a face shield. Face shields aren't like tight to the face. Now, if this was something for standard precautions, though, say the person didn't have COVID or wasn't suspected to have COVID, and you were just worried about getting sprayed because the individual maybe spits back at you when they brush their teeth in a very general non-COVID setting, yeah, a face mask would be fine. A face shield would be fine. But when we're talking about COVID and we're talking about suspected or confirmed cases, or even in general right now, everything's heightened. We want a mask as well as that face shield.
Thank you. Is the procedure to reuse surgical masks to put them in a paper bag for several days? Do you seal the bag or leave it open?
So this, I do not have, I have to say, I really don't have good information on this. The best recommendations are you're not touching the outside of that mask. So being in a paper bag, I'm not certain that I'm going to be able to reach in that bag and not touch the contaminated part of that mask. I don't feel that that's best practice. I'm thinking that it would probably be best, knowing what I know about germs like places that are warm, moist, and dark, you want that bag open to get as much air in so that that mask isn't staying moist. We want our masks to be dry, and if our masks are moist, if they're reusable, we should be laundering them. If they're disposable, then it's time to check them because they really shouldn't be moist. But that's one of those things your employer should have a guideline for you on if they are asking you to reuse a mask in a brown paper bag.
Thank you. I was told yesterday by a healthcare professional that wearing gloves can cross-contaminate more than just frequently washing your hands. I guess, what is your opinion of that?
This depends on your own behavior. So as a nurse, I am extremely kind of obsessive-compulsive about infection control, but it takes a background knowledge to understand. So let's use the supermarket analogy. If I'm going to wear gloves when I go to the supermarket, I am going to imagine in my mind, you can picture whatever the grossest thing is that you want on your hands. But you could picture feces, you could picture mucus, just picture something. You could picture paint if you're squeamish, but picture that you have something on your hands, on these gloves. So you put your gloves on, you're in the supermarket. If you're a female, you have your pocketbook over your shoulder. You're a male, you have your wallet in your pocket, you have your cell phone. You're going through the supermarket, you're touching the cart, you're touching all different things, you're touching packaging. This is fine because we have to do what we have to do. Mainly the way that we get contaminated is by respiratory droplets. So say somebody comes by us, they're not wearing a mask, they're coughing. Maybe this is on our hands. We don't know. Either way, we're assuming what's out there is on our hands. Now we get to the register. The challenge is, what do I have to touch when I get to the register? I'm going to have to go in my pocketbook. I'm going to have to take out my wallet. I'm going to have to take out my credit card. And I am then going to have to, I'm going to have to touch it with whatever nastiness I've pictured is on my hands. And then perhaps I am also touching my cell phone as I'm at the register because I need to get out my Retail Me Not coupon or whatever it is. Now I get out of the supermarket, I take my gloves off, I throw them away. Maybe I even use Purell, but what's the problem? The problem is I touched my pocketbook, I touched my cell phone, I touched my wallet, and I touched my credit card. And all of those things now are considered contaminated. So if I do this, if they don't have order ahead where you can pay over the telephone, like for many takeout things, or contactless payment, I have to then wash down as well anything that I touched with my dirty gloves while I was out. So you really have to think in terms of contamination. And while I was wearing my gloves, what else did I touch? Because as soon as you touch those things again, you're contaminated. But I'd like to follow up, and I'd actually like to follow up and say one more thing about that. And nobody's asked a question yet, but there was a time when there were recommendations when you come home from the supermarket, and we did this in my home. We washed down all of the groceries with an alcohol spray, and it took forever. It was such a pain. But the recent research that's coming out is showing that in general, this is not how things are being spread by like touching your groceries that were in the supermarket. It's going to be those high contact areas like the keypad where you sign your name at the supermarket register, the door handles. It's going to be those high touch areas. And so usually washing your hands, even if you wear gloves and take them off and then wash your hands, that's going to cover it. So you don't have to go nuts like sterilizing everything in your house when you get home. And certainly if you do have something that's contaminated that can't be laundered, if you leave it out in your garage for a few days, that's going to be long enough to kill off whatever it was that you were worried about. So you don't need to obsessively decontaminate everything. Just remembering that, and I think maybe what your friend was saying about washing your hands and being really good about washing your hands is ultimately most important, and to also consider, again, that cross-contamination idea.
Thank you. I know we're 10 minutes over, but we do have a lot more questions. So if you can just hang on, I will keep asking the questions. And thank you for your patience. Do I have to wash my cloth mask every day I wear it, or can I spray it with disinfectant and hang it outside for a day to air out and then wear it again?
That's a good question. If the mask is moist at all, I would launder it. And honestly, I do think it would be best practice to wash the mask every day. If you're not able to, then I would go along the lines of the spraying. But ideally, when we wash things, we remove the germs. When we're disinfecting them, we're killing them. And it's better if we can wash and remove them altogether rather than kill them off. And plus, I'm a little bit concerned not knowing what type of disinfectant is used and where would potentially be breathing those vapors in through a mask. I would more likely recommend washing.
Thank you. If someone is not using a Lysol or Clorox to effectively kill the virus, are there any items in the home that will kill the virus on surfaces?
I'm not aware. I would recommend looking at the CDC website. I believe they have recommendations about where to look for approved chemicals. I do know that rubbing alcohol, it's hand sanitizer, is anything that contains 60% alcohol or greater. So I would say in a pinch, rubbing alcohol, but I wouldn't want to make any across-the-board recommendations without consulting a reliable source.
And this is kind of a follow-up question. For disinfectant, is alcohol or bleach 10% solution better?
I don't have off the top of my head that information, but I can say that it is out there, and the CDC would be a good place to start.
I believe alcohol actually kills the virus faster than the bleach. I think alcohol is 1 minute versus bleach of 5 minutes, but don't quote me on that. I will look into that as well. Do you think people who have hot flashes should be concerned about having their temperature taken given a possible false read?
I think that if you're actively having a hot flash at that moment, you could certainly wait until the hot flash has subsided to take your temperature. Although I can't say for certain, I haven't looked at the scientific literature, whether or not a hot flash is actually a fever. And I don't believe it is. I believe a hot flash is the perception of heat, but I don't know that a hot flash is going to raise your body temperature into fever. But with that being said, if you're concerned, I would just take your temperature at a time when you're not having a hot flash. But that's certainly a good question. I just don't have an answer on whether or not a hot flash raises your body temperature from a thermometer measurement standpoint.
What about virus in stool? I've heard about concerns about virus being aerosolized from flushing toilets.
The concerns over virus in stool and body fluids that are not respiratory are not as high. The evidence, again, because it's so new, it's not conclusive, but according to the CDC, that's not considered a primary mode of transmission. The primary mode is mainly respiratory. So at this point, having aerosolized stool particles from toilet flushing is not a primary concern. You could always, well, I'm supposing that toilets have lids, but I suppose they don't always. But no, that's not a main concern for a route of transmission at this time.
Thank you. What would you recommend using for checking multiple people's temperatures daily? Are disposable thermometers necessary?
Right now, the recommendation is for the non-contact thermometers. And we're seeing obviously a surge in demand for those because that's a way that we can test many people's temperatures without contact at all. So that is the best practice, are those, I think they're infrared non-touch thermometers.
Okay. If you don't wear gloves to the grocery store, you're touching everything with your hands. You're cross-contaminating items as you would with gloves. Is the material from the glove contracting the bacteria more than your hand?
No. If I understand your question correctly, wearing gloves or not wearing gloves to the supermarket, the recommendation is still that PPE be retained for healthcare workers. And so in general, it's not recommended that you wear gloves to the supermarket because, again, you're facing the same issues. As long as you're not touching, COVID's not getting in through your hands, assuming you don't have a gaping open wound, it's not coming in through your hands. So as long as you can be touching all of the items in the supermarket, as long as you are not at the same time touching your nose, your mouth, your eyes, just like you could wearing gloves, you have the same level of protection. You're touching the same things. As long as you're washing your hands with soap and water or using hand sanitizer, if obviously there's not, a sink right next to your vehicle when you're getting into it, then you're probably going to have the same level of safety as you would if you were wearing gloves. So I'm not saying you should wear gloves when you go to the supermarket. That's actually not the current recommendation. But for those who feel more comfortable, who have access to them, who choose to use them, you just have to remember that the gloves themselves aren't what's protecting you. It's the fact that, or I should say, it's the action while you're wearing the gloves is what's protecting you by not touching your face and other items.
Thank you. We are 15 minutes over, so I just wanted to thank everyone. I know there are a couple questions coming through, and I'm going to ask them, but I just wanted to say thank you for staying and sticking around and listening to Melissa. If you can join us on June 9th, Protecting Ourselves, Protecting Others, Part 2, Caring for Someone Infected with COVID-19 in Their Home, please do so. I'm receiving a lot of registrations as we actually are going through the webinar. So feel free to sign off. We will keep recording these questions, and we will send you all the materials, PowerPoints, and recording and a transcript when we put it up. And hopefully it's going to be in the next couple of days. Thank you. Melissa, have you seen good image charts on safety practices for people with intellectual disabilities?
I'm not sure what you mean by safety charts, to be honest. I haven't seen a whole lot of data. Actually, I haven't seen one published research study about COVID-19 in people with developmental disabilities. And as a researcher, that tends to be the information that I look for. So there is not a lot of existing research out there. If you are looking for specific recommendations related to care settings beyond what the CDC has listed, the American Academy of Developmental Medicine and Dentistry has a great resource center related to COVID-19 and care of people with developmental disabilities, with a whole lot of resources there. And they're geared probably more at the level above a direct service provider and more in terms of a nurse or an agency leader. But they have great resources as well, and that may be something more towards the safety piece that you're looking for.
I'm going to post AADMD's website and the Coronavirus Center right now, so I've just posted it in the chat box if you are interested in checking that out. Let me see. We're getting a lot of thank yous. And I don't think there are any, hopefully I did not miss any questions, and I apologize if I did. And if I have, please email me so we can get you the answer. Again, thank you so much for joining us. And Melissa, thank you so much. We've had over 700 people join us live today, so this has been an amazing response to and a sorely needed topic. Thank you again, everyone. Stay safe and healthy, and hopefully we'll see some of you next week. Thank you, Melissa.
Thank you. Stay well, everyone.
Thanks.